Tinnitus is a term for hearing sounds that comes from inside your body rather than from an outside source. It's often described as ringing in the ears, although several sounds can be heard, including buzzing, humming, grinding, hissing, and whistling sound. Some people may hear sounds similar to music or singing, and others hear noises that beat in time with their pulse. This is called pulsatile tinnitus. You may also notice that your hearing is not as good as it used to be, or you are more sensitive to everyday sounds. This is called hyperacusis. Tinnitus is rarely a sign of a serious underlying condition. For some people, it may come and go and only be a minor irritation. However, for some people, it can have a significant impact on everyday life and be very distressing, affecting concentration and cause problems such as difficulty sleeping and depression. In many cases, tinnitus will get better gradually over time, either by disappearing or by the body getting used to it, which you call habituation. But it's important to seek medical advice to see if an underlying cause can be found and treated, and to help you find ways to cope with the problem. Your doctor will typically diagnose you with tinnitus based on your symptoms alone. But in order to treat your symptoms, your doctor will also try to identify whether your tinnitus is caused by another underlying condition. Sometimes a cause can't be found. To help identify the cause of a tinnitus, your doctor will likely ask you about your medical history and examine your ears, head, and neck. There are some tests that you may be asked to do. One of it includes audiologic exam. During the test, you'll be asked to sit in a soundproof room wearing earphones that transmit specific sound into one ear at a time. You will indicate when you can hear the sound, and your results will be compared with results considered normal for your age. These can help rule out or identify possible causes of tinnitus. Your doctor may also ask you to move your eyes, clench your jaw, or move your neck, arms, and legs. If your tinnitus changes or worsens, it may help identify an underlying disorder that needs treatment. Imaging tests can also be done depending on the suspected cause of your tinnitus. You may need imaging tests such as computed tomography or magnetic resonance imaging scan. Lab tests can also be requested for to check for anemia, thyroid problems, heart disease, and vitamin deficiencies. Do your best to describe for your doctor what kind of tinnitus noises you hear. The sound you hear can help your doctor identify a possible underlying cause. Clicking test can also be done. This type of sound suggests that muscle contraction in and around your ears might be the cause of your tinnitus. Pulsing, rushing, or humming. These sounds usually stems from blood vessels called vascular causes. Low-pitched ringing. This type of sound may point to ear canal blockages, Meniere's disease, or stiff inner bones, also called otosclerosis. High-pitched ringing can also be tested for. This is the most commonly heard tinnitus sound. Likely causes include loud noise exposure, hearing loss, or medications. Acoustic neuroma can cause continuous high-pitched ringing in one ear. Treatment for tinnitus depends on whether your tinnitus is caused by an underlying health condition. If so, your doctor may be able to reduce your symptoms by treating the underlying cause. Examples of what may be done includes earwax removal. Removing an earwax blockage can decrease tinnitus symptoms. Treating a blood vessel condition can also be done. Underlying blood vessel condition may require medication, surgery, or another treatment to address the problem. Hearing aid have also been used for management. If your tinnitus is caused by noise-induced or age-related hearing loss, using hearing aids may help improve your symptoms. Changing your medications have also been advised. If a medication you are taking appears to be the cause of your tinnitus, your doctor may recommend stopping or reducing the drug or switching to a different medication. Noise suppression have also been used in the management of tinnitus. Many times, tinnitus can't be cured, but there are treatments that can help make your symptom less noticeable. Your doctor may suggest using an electric device to suppress the noise. Such devices include white noise machines. These devices, which produce sounds similar to static or environmental sounds, such as falling rain or ocean waves, are often an effective treatment for tinnitus. You may want to try a white noise machine with pillow speakers to help you sleep. Fans, humidifiers, dehumidifiers, and air conditioners in the bedroom also produce white noise and may help make tinnitus less noticeable at night. Masking devices can also be used for management of tinnitus. These are worn in the ear. These devices produce a continuous, low-level white noise that suppresses tinnitus symptoms. Counseling is also an important part of management. Behavioral treatment options to help you live with tinnitus by helping you change the way you think and feel about your symptom. Over time, your tinnitus may bother you less. Counseling option includes tinnitus retraining therapy. This is an individualized program that is usually administered by an audiologist or at a tinnitus treatment center. This combines typically you wear a device in your ear that helps mask your tinnitus symptoms while you also receive directive counseling. Over time, tinnitus retraining therapy may help you notice tinnitus less and feel less distressed by your symptoms. A licensed mental health professional or psychologist can help you learn coping techniques to make tinnitus symptoms less bothersome. Counseling can also help with other problems often linked to tinnitus, including anxiety and depression. Many mental health professionals offer cognitive behavioral therapy for tinnitus in individual or group sessions, and these programs are also available online. Medications have been used for the management of tinnitus. To help relieve your symptoms, your doctor may prescribe medication to treat an underlying condition or to help treat the anxiety and depression that often accompany tinnitus. Researchers are investigating whether magnetic or electrical stimulation of the brain can help relieve symptoms of tinnitus. Examples include transcranial magnetic stimulation and brain stimulation. For many people, certain adjustments make the symptoms less burdensome. These tips may help. One is by using hearing protection. Over time, exposure to loud sound can damage the nerves in the ear, causing hearing loss and tinnitus. To keep your tinnitus from getting worse, lifestyle and home remedies have been found to help reduce tinnitus. Alternative therapies that have been tried for tinnitus include acupuncture, melatonin, and zinc supplements. Thank you for watching.